Hey everybody, it's Nate Charles. I'm back. Welcome to another installment of the Rule of Law Brief. It's October 4th, 2025. You've heard the line about 1,000 times by now. Democrats want to give free health care to illegal aliens. It's one of those applause lines that Republican candidates roll out at every debate and every rally. But when you peel it back, what they're talking about isn't free health care, and it isn't really about immigration. It's about how our entire emergency healthcare system works, a system that all Americans depend upon, and how they twist it into a wedge issue. Now, to be fair, there's a tiny kernel of truth buried in their claims. It's microscopic, really. The difference between what they're saying and a flat-out lie is about 1 micron thick. In other words, completely invisible to the human eye. Yes, it's true that under federal law, hospitals must treat everyone who shows up in an emergency, and that includes undocumented immigrants. But it also includes uninsured citizens, veterans between jobs, and kids whose parents can't afford coverage. So technically true? Sure. But the nuance underneath that truth is so massive that the claim becomes disingenuous to the point of becoming a lie. And the irony is that the law that makes this possible wasn't passed by Democrats at all. It was passed by Ronald Reagan. Let's start with that law. EMTALA, the Emergency Medical Treatment and Labor Act, passed in 1986 and signed into law by Ronald Reagan. EMTALA requires any hospital that accepts Medicare funding, which is basically all of them, to provide emergency medical screening and stabilization treatment to anyone who comes through the door, regardless of their ability to pay and regardless of their immigration status. It's one of the most important healthcare protections in American history. It prevents what used to be called patient dumping. Hospitals refusing to treat people because they were poor or because they were uninsured. But here's the catch. EMTALA is what's known as an unfunded mandate. It tells hospitals that they must do something, but it doesn't pay for anything. All right, so what you have here is a graphic showing how EMTALA works and how EMTALA is paid for. Admittedly, for those of you consuming this in a podcast, this graphic isn't going to do you any good, and for that I apologize. On the left side of this chart is EMTALA, the expense. Every hospital has to stabilize emergency patients. That's the Reagan-era promise. On the right are the offsets, the federal programs that help hospitals survive financially in the face of these EMTALA obligations. First, you have emergency Medicaid, which reimburses hospitals for emergency treatments of patients who would qualify for Medicaid except for their immigration status. It's jointly funded by states and the federal government. When Republicans say that Democrats are trying to provide health care to illegal immigrants, this is the program that they are most directly referring to. But I'll explain more about that in just a minute. The second program that helps hospitals offset their EMTALA obligations are disproportionate share hospital payments, or DSH payments. These are fully federal funded through Medicare and Medicaid and go to hospitals that treat large numbers of uninsured and low-income patients, the rural and urban safety net hospitals that keep the medical system in the United States alive. Together, these programs don't make hospitals rich. They just keep the lights on in face of their EMTALA obligations, their duty to provide emergency health care to everyone. They are the financial backbone that allows EMTALA to function in the real world. But here's what's happening now. The Trump administration and congressional Republicans have not repealed EMTALA. Hospitals are still legally required to treat emergency patients, but they've cut and constrained the very programs that keep the hospitals alive in the face of those EMTALA obligations. In 2025, their so-called reconciliation bill essentially cut $8 billion from those programs that are meant to offset hospitals' EMTALA obligations. At the same time, the administration has been tightening rules about how states can claim federal reimbursement when one of these patients that the hospitals treat under EMTALA turns out to be undocumented. So while they rail against free health care for illegals, what they're really doing is starving the hospitals that treat uninsured Americans, the very citizens who rely on the EMTALA programs to survive. It's a classic bait and switch. Keep the moral law on the books, but choke off the money that makes it in any way workable. And that's the heart of the matter. The majority of people helped by these programs are American citizens. These are people who lost their insurance, live in poor or rural areas, and have few other options for healthcare. Undocumented immigrants are only included because it's impossible and immoral to check immigration papers when you're giving somebody CPR. So when Republicans attack these programs, what they're really doing is jeopardizing emergency care for everyone. It's the policy equivalent of saying we shouldn't build roads or bridges because an undocumented immigrant might incidentally drive on them someday. Roads aren't built for one group. They're public infrastructure that keeps the whole country moving. So is emergency medicine. To dismantle that infrastructure out of spite isn't fiscal conservatism, it's cruelty disguised as financial prudence. Republicans also love to point to California or New York and say, look, Democrats are giving free health care to illegal. But here's the trick. Those programs are entirely state funded. The federal government doesn't pay a cent. States use their own dollars to cover preventative care, vaccines, checkups, precisely because it reduces emergency room costs later. These state programs have no connection to the federal budget whatsoever. Zero relevant to a government shutdown. But they're convenient villains. So Republicans roll them out in the same narrative to make it sound like a nationwide giveaway to illegal immigrants. Republicans are also invoking entirely hypothetical programs. Programs that don't actually exist at all. Programs that have merely been floated as an idea, like letting undocumented immigrants buy insurance on the Affordable Care Act exchanges with their own money. These are just ideas. They're not law. They're not even policy. They don't cost the federal government a dime, but Republicans talk about them as if they're already on the books, using imaginary policies just to justify real cuts to hospital funding. It's worth pointing out that these Republican talking points tend to work because our healthcare system is so complicated. EMTALA, emergency Medicaid, DSH payments, state programs, ACA rules. It's a patchwork of overlapping systems, and it's incredibly complex. That complexity makes it easier for bad faith actors to blur lines and mislead the public. And that, in and of itself, is one of the strongest arguments for a universal single-payer healthcare system, one that ends the patchwork and stops allowing 1-micron-thick lies to masquerade as policy debates. So the next time you hear someone shout that Democrats want to give free healthcare to illegal aliens, remember what's really going on. They're attacking a Reagan-era law that protects uninsured Americans. They're cutting the programs that keep your local hospital's doors open, and they're doing it while pretending that they're protecting the taxpayers. That's not conservatism. That's sabotaging the healthcare for millions of Americans. If you found this helpful, share it. Facts don't spread themselves, but they can cut through that 1-micron lie in a heartbeat. Thanks for listening in. I'll have more for you as soon as I can.